of the disease process. So, that's that HGBS, that sickling, the hemoglobin sickling, causes that to siphon and elongate. So it's an elongated cell. The erythrocytes take on a sickle shape, so that's what we're talking about. And then this is kind of like a breakdown in a pathophysiological sense of what happens. So that's a visual for you. Types of STD, sickle cell, most severe. There's the most severe, and then there's just the homozygous of the double S. Okay. So there's sickle cell thalassemia, sickle cell HBC, and then the sickle cell traded cell. So understand the difference, and I put that in here for you at the bottom, the breakdown. You don't even, unless you need to go back to the book for referencing, it should be pretty clear here, all right? What I try to do is put everything I try to put things in the PowerPoint, which you have to read too to have a clear understanding. But I try to cover everything that you're going to need in the PowerPoint. So here's what we're looking at. So this is the shape that we're talking about. So this is normal, this is not. And this is the problem with this disease process, okay? The major pathophysical event is triggered by the one said earlier, the low O2 tension in the blood. There's not enough oxygen flowing in the blood. So the patient is at a greater risk for infection due to that lack thereof. Okay, so we're concerned about the potential for hypoxia or deoxygenation is what we're talking about. These people are not to be at a high altitude. Why? Why do we say they should be able to There you go. Very good. Very good. The concentration. Okay. So, it's severe disease process, very painful. The patient goes through acute exacerbations where they have to be hospitalized to get treatment, to get them back on track. So, there's the hypoxia, and it can be life-threatening with the severe depletion of the oxygen in the tissue. So this is why one of the nursing diagnoses would be tissue alteration of tissue production. Okay, if you're caring for these patients. I'm not going to do the case study aspect of it here. Symptoms may include, we talked about the theme, the lack of oxygen, so hypoxia, pale. Now, if you're looking for paleness in a dark-skinned person, where do you look? You look in the mouth. Where else? Well, yeah, palms of the hands you can look at. Anywhere else? What? The feet, the ones at the feet. Yeah, that's a possibility. The bottom one, because if you're looking, they could be pale in general, but you want to look at other places to really get some idea about the adequate deficiency. Yes, thank you. The conjunctiva. Very good. Yeah, I was trying to think of that third one, but that's it. Okay, so you really want to make sure that you are assessing these patients. Many people with sickle cell anemia are in reasonable good health the majority of the time, but it's like when they go into crisis, that is where the problem lies, and they need attention right away. And many times they have to be hospitalized. But because of that lack of oxygen, some of the major organs are at risk, like your kidneys. Okay. So here's what we're talking about. We look at it in an organ sense. the symptoms associated. So this is a good view for you to study and get an understanding. We do want to look at the bones and joints, because that's where they have that pain. Okay? Which is, again, secondary to hypoxia. Complications, infection is huge. It's a major cause of morbidity and mortality in these patients. Okay? The pneumococcal pneumonia is the most common when it comes to pneumonia respiratory-wise. Severe infection can cause aplastic crisis. It can lead to shutdown of their RBC production. So that's why it's important when they come in that we give them oxygen right away. Okay. Let's see. Next. Acute chest syndrome. Pulmonary complications associated. So we're talking now complications. Now, mind you, we got to study the complications of each particular disease process. So look at that in terms of respiratory. Can be fever, chest pain, coughing, dyspnea, but it leads to multiple serious other complications like heart failure, for instance, pulmonary, and maybe an MI. These are hypertension, these are serious cardiovascular complications that can occur in patients if they're not treated. Diagnostics. Well, how do we get an idea of how severe the problem is? I mean, we can get a visual and look at them and see that they're in distress, but otherwise we want to get to diagnostics. So we're going to get a peripheral blood smear. We're going to look at the syphilis test, which is very important. Electrophoresis of the hemoglobin, that's the element of the culprit. Skeletal x-ray to get an idea about the bones and the joints, and then make an MRI and x-ray. Okay. Now, your role. What do you do? Well, if you think about what is going on with these patients, what are we seeing, then it gives you some idea about how you should care for them. What's your role? I'm always going to ask you, what is your role? Because that is what NCLEX wants to know. We want to know, do you know what to do for these patients in a given situation? So if a sickle cell patient came in, what do you think you might do first?
Oxygen.
This is a good question. Is it oxygen, hydration, or pain management?
Pain management.
It's going to be pain first. Now, I can see the understanding of thinking, I need to get them on some oxygen right away. But that pain needs to be controlled first. So, take care of the pain, then the oxygen. In many cases, you might have someone else working with you who can do that. Now, we all know that it's a given. You can put 2 liters on a patient without a doctor's order. That's okay. So that's what I would do. Take care of the pain, put them on 2 liters, and then you get to the point of now you're getting them comfortable. See, that's the idea. We've got to get them comfortable first. Let's help them first. So NCLEX wants to know, what are you going to do in that situation, and those are the things you want to address. Then yes, someone mentioned hydration. Okay, we got to get an IV line in, and that might be first. Why? Because you got to get to the pain management, because we want to give them something IV push. So that, theoretically, but it's based on how that question is phrased and how you look at it and what's there in the question that you get the right answer. Okay? Okay. So we want to alleviate any opportunity for complications. So promptly treating serious sequelae means the symptoms. And you can see here, no high altitude, maintain adequate fluid intake. So education for these patients are really important, because many times they're young. Okay. and it's difficult. I also think that for these patients, you should have a psychosocial diagnosis. If you have a sickle cell patient in clinical, I think you should have, particularly if they're younger, you want to, not necessarily, but particularly if they're younger, have a psychosocial. What kind of a psychosocial diagnosis do you think would be appropriate? What's that? Anxiety because of maybe the pain? I think someone may say socialization. Yes, because sometimes they're isolated. I think also the fact that we're looking at, they have to go through this sometimes on a regular basis, and what that must do to their psyche. Okay? As a young person who's not able to go out and live like, if you look at someone who's 20, your average 20-year-old, they're not going to be able to do the same thing. Okay? So let's look at that. Screening for retinopathy should begin at the age of 10. Okay. And it's going to be important for these patients to make sure you teach them to get their immunization. Because we want to, particularly, what are we concerned about? The flu, influenza, okay, and hepatitis, and the pneumococcal as well. So your teaching will come under that, and that's going to be later. I mean, you're not going to try to teach someone who's just come in and they're in pain. That's going to come later in your treatment process. I mentioned that most times they are hospitalized because they are in a sickle cell crisis. Oxygen is the #1 problem. Vigilance for respiratory failure. They need to rest. They need to rest with DUC prophylaxis. So they're not going to be able to get up and move around a lot. We want them to rest first, but because they are resting and they're not moving, we want to prevent DVT. So we have to put them on DVT prophylaxis. Okay, maybe your low dose, low monoxide, something like that. We want to give fluid. Someone did mention hydration, electrolytes, yes, and transfusion therapy that looks at in reference to the potential for resuscitation. Okay. These patients like those with thalassemia, major thalassemia, may require iron, is what this is referring to, transfusion therapy. So they may need iron replacement. Pain management, also pain medication tolerance. Back in the day, when I was a nurse, we used to give a lot of Demerol. But they found out that Demerol caused more of a problem in its health. So what is the drug of choice now?
Morphine.
Very good, morphine. Okay. And they do need to get their pain medication. So hydromorphone can be used. So in other words, morphine or Dilaudid. Hydromorphone is the other drug of choice, but usually it's going to be morphine. So you could get a question on that, and you will know what to answer. Treat the infections. Okay. So once we get them settled with the oxygen, the pain management, hydration, now we want to start with the IV, and we want to try to treat the infection. We will give them folic acid, okay. Although pain is the most common symptom, infection is a frequent complication. So we want to make sure that we deal with that. Blood transfusions have little if any role in treatment between crises as patients develop antibodies to RBC. So we're not going to be involved with that. Hydrea is only anti-cyclination care of your teaching. Remember, the last thing on my list that I gave you earlier, teaching. So INCREX wants to know that you understand how important it is for teaching the patient and the family. So teaching, when it's appropriate, will have to be done. Because we want to teach them how to prevent and to avoid the crisis. Sometimes they're so young that they get themselves into crisis. Importance of prompt medical attention and pain control. We don't want them to get hypoxic. No high altitude, which can cause that. And seeking medical attention quickly to counteract any problems associated with infection. Okay, so I took out, let's forget, I took out acquired hemolytic anemia, so you don't have that. So I took out 98 through 105. All right? Loss of anemia. So, in summing up with this, I want you to be able to distinguish between the different ones that I pointed out I want you to know. Okay? So, understanding what they are about, what's the missing element, how we're going to treat it, what are the signs and symptoms, would you be able to recognize in a person? So look at it from that perspective, because your questions are going to be kind of designed that way, with that information in mind. Okay, any questions about that? Okay, so let me get into the next one, and then you'll take your break at 3:10. That'll be your 20-minute break, okay? So now we're going to go into cardiovascular. Now, let me pull this chart up. You have got to know the blood flow of the heart. If you don't know it already, then you got to learn it. So I put this in for you. So, I think it's a book. So always know that blood first, you've got to go into the superior and inferior vena cava. Right, what's the next?
Right atrium.
Right atrium.
Tricep.
Right ventricle. Yeah.
And then they return back for... I think you got it. So everybody got it, right? Yes.
Okay, so when it does the pulmonary, right, it goes into the pulmonary artery, then where does it go? And to the lung. Now, the thing I want you to know is when it hits the lung, it is oxygenated. Very good. That's important to know, because not that I'll trick you with a question, but just so that you know. And then it goes into the pulmonary. There you go. Now you got it. Now you can close this, because that's important. Okay. Now let's go back to... Okay. We're going to get the chart, and now we're going to look at it. Now, quite a bit to look at cardiovascular, but I think what I tried to do, I think I put it all in one. I don't know. Let's see what I have in this problem. Now there should be some elements that you remember from cardiovascular related from last semester, right? Maybe? Some aspects? A little bit?
What class are you referencing?
Yeah, I thought maybe you guys had, some aspects of cardiovascular with the key.
We're taking that.
Oh, you're taking that
That's what we take.
Did you talk about it, anything at all with,